Rabiosa Medina Radio. Two Chicago reporters speaking on immigration and politics.
Rabiosa Medina Radio. Two Chicago reporters speaking on immigration and politics.
The world needs people to save lives.
العالم يحتاج إلى أفراد لإنقاذ الأرواح.
El mundo necesita personas para salvar vidas. Hi, my name is Leslie.
And my name is Diane.
Thank you for tuning in to Rabiosa Medina Radio. We're very excited to do our first podcast. And so Diane, do you want to start and tell listeners who is Diane?
Sure. First of all, hey, Leslie. Hey, everyone who's listening. So, my name is Diane. I'm currently a reporter in Chicago at Borderless Magazine. It's a Chicago nonprofit online news outlet that covers immigration-related stories. And I recently graduated from Northeastern Illinois University with a sociology degree. I love sociology, I love journalism, and my concentration in my undergrad was journalism. And that's actually where we both met, me and Leslie. We actually met in our journalism class. We were very driven, and we always knew that we wanted to collab. So my personal interests are really in the local and outside world on global affairs, social injustice, immigration, and marginalized communities. And I guess that's really why I'm so excited for this project with Leslie. I'm Lebanese myself, and Leslie is Mexican. So, us both having that background and the culture, we incorporate both the background and culture as co hosts. And I feel like it adds fun, experience, and just more information for ourselves and also our listeners. And especially as us being based in the city of Chicago, which is so diverse, there's so many stories out there. There's so much more than what meets the eye.
Thanks, Diane. That was a great introduction. So, hi, everybody. My name is Leslie. I am a senior at NEIU, and that's where I met Diane. And I'm just so grateful that I met her because the first time I saw her, I just knew that that person was going to be my friend. And to collaborate and do something like this has always been something I've wanted to do. So, I'm at NEIU and I'm studying communications with a minor in journalism. It's always been my passion. I have an interest for the field of broadcast journalism. There are not a lot of Latinx journalists in the newsroom, and I kind of wanted to see if I could challenge the coverage on vulnerable populations in Chicago. And I just want to give people in those areas a voice. And I think that's why this podcast is so special, because we're giving a voice to the voiceless and we're covering unique topics that you don't see in mainstream media. So that's always been a passion of mine, to cover things that you just don't see on TV. And this podcast is something that I'm really looking forward to. So thanks, Diane, for collaborating with me. I'm very grateful for you.
Of course, I think we both share the same interests when it comes to reporting, and we both have a passion for human stories. And that kind of leads us to go into explaining why we called the podcast Rabiosa Medina Radio. So, as I said before, I'm Lebanese and Leslie's Mexican herself. And so she speaks Spanish, I speak Arabic. As I said, we wanted to both incorporate our culture, our background, our heritage into the podcast, whether it's from stories or the name. So Rabiosa means furious in Spanish, and Medina or Medine means city in Arabic. And so we both thought it would be a cool thing to put it in the name, and it worked out. And yeah.
Yeah, and I think it's so funny that when we were thinking about the name, that you mentioned Shakira and Salma Hayek, because Shakira is Colombian and part Lebanese, and Salma Hayek is Mexican and Lebanese. So that's very interesting where there's this mix. And so I think the reason why we wanted to do this is because a lot of podcasts are monocultural and you just don't get a mix of politics or stories from other countries. Like most podcasts, they have two hosts and they're from the same ethnicity or they're both Latinas. And it's just interesting that we have different cultures and we are meshing them by doing this podcast, by bringing in people that we know and know about the countries where our parents reside in. Yeah, and so, yeah.
Yeah, and speaking of culture, as I mentioned also before, Chicago's so diverse in culture, and Illinois is one of the hot spots, and we almost, I think all it's going to reach 80,000 COVID-19 cases soon. And I recently wrote an article for Borderless magazine that was about the neighborhood I live in, which is West Ridge neighborhood in Chicago. And in the beginning of April, it was one of the hot spots. And now, of course, other neighborhoods have beaten that or on the same level. But I think it was interesting and fun to write this article to go around my neighborhood and ask the businesses what they're up to, how they're reacting, how their employees are doing, and how their sales are doing, and just their overall opinion, and just to hear them out of what's going on during COVID-19 because it really has been causing tragedy and it's been causing a lot of losses in this world. And America has reached obviously more than 1 million confirmed cases. And so it's good to highlight different types of communities and different ways of storytelling when it comes to COVID-19.
Yes. I think when you like document or write on different places or communities, you get the sense that there's so many stories that are untold. Another reason why we wanted to start this is we want to basically go into those communities and ask tough questions and understand more about Chicago and around the world.
Yeah. And I know both of us are kind of, social distancing from our family, whether they're living abroad or they're living in the city. I know your mom is an essential worker and she's, out on the fields and just working because she has to. And so really credit to her and I hope she stays healthy and well throughout this whole pandemic and that you get to see her soon and both of you are healthy.
Thank you so much.
Yeah, and I know my mom and sister, they're also in Lebanon and they don't have as many cases as we do in the United States, but of course, it's better to be cautious and,
So, how are you keeping in contact with her right now?
yeah, so this is where the internet comes in handy and I'm so thankful for technology and everything. So I do talk to her every day. So I don't feel any too much distance even though I miss the human contact. But yeah, I mean, they have, their death toll is not as much as here. Their cases are not as much as here in the US, but they're doing okay and they're just practicing social distancing. And now, currently, they have a 4-day lockdown and they've just been staying home ever since March. And we have to do what we have to do to stay safe and to stay healthy, regardless of what's happening.
So, Diane, I recently discovered that Lebanon is experiencing some conflict. Do you happen to know about what's happening? And does your mom know about what's happening? And is she safe?
Yeah, so ever since October 17th, there's been a revolution, and they call it the October Revolution, where protesters and civilians and people have been going down on the streets demanding their basic rights. And, they're complaining about their unemployment, the lack of efficient healthcare. This is what they deserve. And every, you know, I say that the politicians and the people who are in administration, they're our servers, and they should be listening to our voices. And we haven't been seeing that in Lebanon for decades, and especially recently. And not only has there been the revolution, but Lebanon has been going through instability throughout many years. And recently, there also has been natural disasters and floods and wildfires, as we saw back in October. So, yeah, we reached out to the Lebanese Red Cross, which is a group that has been on the ground helping the Lebanese for decades. Ever since 1946, this humanitarian organization has been helping those in a health crisis by sending ambulances for emergencies. Regardless of social class, race, religion, and any sectarianism, it is all about helping others. Lebanon has been through a lot throughout the decades. Although the stability may seem on and off to some, it has recently been through a natural disaster of wildfires back in October, as well as protesters on the streets calling for a revolution since October 17, 2019. The Lebanese Red Cross has been helping those who are vulnerable no matter what. Here we have with us today on today's episode is our guest, Dr. Shawqi Aminuddin, who is the Director of Training and Assistant EMS Director for the Lebanese Red Cross, to talk about COVID 19 and first responders in Lebanon. Thank you so much for being here with us today, and thank you for the work that you do as well.
It's a pleasure to be here with you today.
Thank you. And so today's episode is about first responders in Lebanon during COVID. So I guess we want to start basically, maybe have you tell us a little bit more about why Lebanese Red Cross is so important to you and how you started out with it.
Okay, so personally speaking, I've been a volunteer with the Lebanese Red Cross for the past 14 years. Mainly, first of all, I joined as a volunteer in the emergency medical services sector, and then I became a trainer, and then head of station, and then became the training director and the assistant EMS director. In the Lebanese Red Cross, being part of the international movement for the Red Cross and Red Crescent, abides by the seven principles, which you have already mentioned a few of them, which include humanity, impartiality, neutrality, voluntary service, universality, unity, and independence. Of course, one of the main goals is to remove suffering from people, to preserve human dignity, and to save lives. And that's how the Lebanese Red Cross has been working for the past 75 years since its establishment. And throughout these years, we have been through a lot of crises, and including both natural and man-made disasters. And throughout all of these events, the Lebanese Red Cross has stood by the Lebanese population, providing the humanitarian services that we provide through our five sectors, being disaster management, emergency medical services, blood transfusion, medical social services, and youth sector. And I think throughout this episode today, we will be discussing more the role that we have been playing as part of the response to the COVID-19 crisis.
Right. Was COVID-19, the pandemic, was it a surprise? And how can you tell us a little bit more about the preparation towards this pandemic?
Whenever you talk about crisis management, the first pillar in responding to any crisis is in being proactive. Once you start responding to any crisis in a reactive manner, then you have already lost your fight in that response, and you won't be able to respond properly. Accordingly, and part of the response preparedness of the Lebanese Red Cross, the Lebanese Red Cross has set multiple contingency plans for possible scenarios, crisis scenarios that might happen in Lebanon. These included armed conflicts, population movement, natural disasters such as earthquakes, floods, wildfires, and epidemics was one of the contingency plans that has been put. Of course, it was not corona per se, but it was any epidemic or any communicable disease. And as you mentioned earlier, since October, we have been responding to crisis nonstop, starting with wildfires, then moving to the floods that happened, then the protests and the civil unrest, and finally now reaching COVID-19. In addition to that, this is not the first time that we prepare ourselves and our volunteers to respond to epidemics. Back in 2014, the Lebanese Red Cross did some sort of preparation to respond to Ebola. And at that time, we didn't have any patients in Lebanon, but our volunteers were trained. We have written our policies and procedures, and we have both a contingency stock of personal protective equipment, the PPEs, and this stock has been kept as a contingent stock for any potential epidemic outbreak. So back in January 2020, when we first started detecting cases in the MENA region, mainly the first few cases that appeared in United Arab Emirates, the Lebanese Red Cross made the decision to trigger or to activate this contingency plan and to review its policies and procedures. And this was a very crucial step that we did at a very early phase. And that was when we started a whole workshop that included all the different sectors of the Lebanese Red Cross to ensure relevant preparedness to respond to COVID-19. And that was when we reviewed our policies and procedures, increased our stock of personal protective equipment, created the response plan, and what are these sectors and what are the main objectives of the Lebanese Red Cross response. And that was when we started actually training our volunteers and increasing our capacities in order to be responding to COVID-19. So that till today, we have more than 1,300 volunteers trained in 47 stations that are all over the Lebanese territories.
Thank you. So I have a question as well. What are some things you witness while out on the field?
Mainly, when we go on the field in any mission, we always talk about risk. One of the major things that you need to take into consideration whenever you respond to any emergency is to try to mitigate the risk. Working with COVID-19 was very different because when you respond to wildfire or to war or armed conflicts, the main risk that is present is actually a risk that faces the rescuer himself. However, with COVID-19, the issue was much more than that. Our rescuers were facing a risk that is invisible and a risk that they can take back. So, in usual operations, the risk ends once you finish your mission and you go back to the station. However, with COVID-19, the risk was every day, present everywhere. And it was very annoying because it was something that you can take back to your family and to your loved ones. And this was very, very exclusive to the COVID response. And to add to that, during the first period of the response, people were really afraid. So that was when we had a lot of stigma associated with the ambulances, with our rescuers. Even some of our friends didn't want to see us because they thought that we can, because we are responding to missions, then we are at a higher risk and we can transmit the disease to others. And this was the first time that we face that sort of stigma. People usually rush to help the ambulance. However, with COVID-19, people started linking the ambulance with the disease, and this created some sort of, this was annoying. I mean, for the volunteers, and this was one of the main things that we at the headquarter level and as well as at station levels worked hard in order to raise more awareness that the rescuers do not represent the disease per se.
Thank you. And so I was looking at a video of the Red Cross on YouTube, and most of the volunteers said that they would rather volunteer than participate in protest. Can you tell me a little more about that?
Whenever you decide to join the Lebanese Red Cross, the first session that you ever take, the first training that you ever attend, is related to, it's called Dissemination Training, and it's related to actually understanding the essence and the principles behind the movement. And this movement by itself was based on some fundamental principles that include, as I mentioned earlier, humanity, independence, impartiality, and neutrality. And once you decide to be part of this movement, you know since the beginning that you will let go a lot of things. This includes your sharing your political opinion, which remains for you, participating in protests, supporting specific political parties or political decisions, and so on. Although when it came to the protests, this was not a strong political movement by itself. However, it was very important for our volunteers to remain neutral and not to take sides and to remain impartial regardless of their own internal beliefs, in order to be able to support and help everyone, because at the end of the day we will be transporting patients who are pro and against the protest. We will be delivering our services to anyone who needs us, and this is something that really means that much to our volunteers, that they I mean, most of the volunteers prefer to remain in the stations and to provide these services rather than participating in the protest, because they genuinely believe in the importance and they believe in the mission of the Lebanese Red Cross.
Hmm. Yeah, thank you. So, can you tell us a little bit more about what the Lebanese government is doing to lower the spread of the virus?
Okay, so again, back in January 2020, the Lebanese government initiated a ministerial committee to follow up on the issue, to be like some sort of technical support for the government related to the COVID-19 outbreak, and that was even before we had any registered cases in Lebanon. This committee had a representative from most of the ministries, along with the internal security forces, the Lebanese armed forces, as well as the Lebanese Red Cross. And mainly, there have been many things taken. These include the lockdown that was made. The decision was made at a relatively early stage, closing the airports. Now, the Ministry of Public Health is actually doing the testing for the PCR testing. Now, they moved from targeted testing to random testing in order to have a good idea about what's going on in terms of clusters. How are they? What's the spread of these clusters, and who are the people that are at risk?
And recently, we heard that Beirut airport is closed until June 8th, and now there is a complete lockdown in Lebanon from May 13th to May 18th. And so, has the mortality rate been decreasing, or have you been seeing a growth of number of deaths since the outbreak hit?
The mortality rate in Lebanon is very acceptable. So up till May 14, the total death toll has been 26, which is a relatively acceptable number. We have out of 886 confirmed cases. The total lockdown has been initiated in the past few days, mainly to ensure. So after we started having a drop in the number of newly confirmed cases, suddenly Lebanon started receiving a second wave of cases. So as they started to ease the lockdown and started to reopen the workplaces and so on, we started seeing a rapid increase in the cases among the locals, not just from those who are returning from abroad. And that was the main trigger for the government to make the decision to enforce a complete lockdown for 4 days, and to reassess the situation after these 4 days, so that they can decide how to move forward based on the number of new cases that would appear within these 4 days of total lockdown.
Thank you, doctor. So, on October, I believe the revolution started and people were on the streets. Can you tell me or tell us a bit about how the Lebanese Red Cross took a role in assisting people in the midst of conflict?
So the Lebanese Red Cross played a very important role in providing humanitarian services to everyone who needs such services, um, during any time of the year, and this was the same during protests. So the Lebanese Cross increased its capacity and mobilized more ambulances to cover the areas that included protesters in order to provide first aid and rapid and efficient transport to the hospitals for injured and sick during these times. And we also kept, of course, our emergency line, the national emergency line, the 100 and 140, the 140, available to support all and to receive and manage all calls that have been related to any health emergencies, especially calls that are related to injuries that happened during the protest. And also there was a mobilization of resources at a headquarters level, where a team was created to manage this crisis and to follow up and ensure that we have enough resources and capacities that cover all the areas, because this was a widespread protest. They were not localized in one place. So we had to mobilize our resources at all over the country in order to make sure that we cover the different areas.
So, are there some people that lack insurance or funds to cover medical expenses? And how are people from vulnerable areas in Lebanon being provided treatment?
Definitely, with the current economics crisis that's happening in Lebanon, more people are finding difficult having access to healthcare services in various areas in Lebanon. I know that the Ministry of Public Health has a certain role that they're playing in providing assistance to these people. UNHCR is having another role in supporting non-Lebanese vulnerable groups who require medical assistance and healthcare services. This is not one of the main areas where the Lebanese Red Cross actually has a big role. Our role focuses mostly on the pre-hospital care and pre-hospital life support.
Yes. So now that we're talking about the work that the Lebanese Red Cross has done and the preventive measures to halt the spread, I wanted to ask you, have volunteers died while helping others during the protest and the COVID-19 outbreak?
So when we talk about disaster preparedness, one of the main things to ensure any response is safety. And as I mentioned earlier, regardless of all the measures that you take, you can never reach zero risk. So whether it was in fires and floods and protests or even during the COVID-19 outbreak, we know that the risk is there. However, the Lebanese Red Cross is currently practicing the highest safety measures in terms of ensuring and enforcing social distancing, appropriate disinfection, provision of PPE. We have even upgraded our level of personal protective equipment that we respond with to emergencies, from basic to intermediate to all emergencies. We're responding to any patient who's suspected to have COVID-19 with advanced personal protective equipment. Projection based on international numbers uh, showed that probably we might have multiple rescuers affected during COVID. However, today we have finished our third month into the intervention, and now we are starting our fourth month. And up till now, thank God, we have zero affected rescuers among the volunteers of the Lebanese Red Cross.
Thank you.
Mhm. So, as we know, this pandemic is obviously global, and we've seen throughout many countries the shortage of essential masks, ventilators, just the essentials to protect yourself from this virus. As the Lebanese Red Cross trainers and the volunteers are essential workers, was there a shortage or was there a worry of shortages with the masks?
Yeah, so it's not only the mask, it's all the personal protective equipment. The main issue now is that the outbreak has become a global pandemic, as it was declared by the World Health Organization. There's a high demand on the personal protective equipment, and the supply is limited. And definitely, it's one of the main worries of every responding agency, whether it's pre-hospital or hospital-based, or a nurse, a doctor, a paramedic, an emergency medical technician. We are all worried about the personal protective equipment. However, the Lebanese Red Cross has maintained a very good stock of personal protective equipment. We have been through contingency planning as to what to do in case any of our personal protective equipment is out of stock. So, what are the alternatives? And so far, we have our current plan. We have a plan B, a plan C, and a plan D for the personal protective equipment to ensure the safety of our rescuers and the safety of the patients whom we are transporting.
Yeah, thank you so much.
So, doctor, I wanted to ask you, how do you feel serving others during this pandemic?
First of all, this was the first time I'm not part of the. I'm not in the front lines, and this was pretty weird for me. So, for example, when we had the wildfires, I was the incident commander of the crisis that happened. When we had the protests, I was volunteering in the front lines. However, when it came to COVID response, I had more of command role rather than and training role rather than being in the front lines. And I always say this, that regardless of all the work and the effort that you put into building curricula and writing policies and managing the response, really there is nothing that's even close to the feeling that you get whenever you ride in an ambulance, having your suit on, and try to serve those in need at the front lines. So, although I'm really happy with the work that we're doing as Lebanese Red Cross, definitely I still have this, that I really miss being on the front lines with the rescuers. And here, allow me to give a tribute and to salute all our volunteers on the front lines who are really doing such an amazing job and such a great job ensuring that everyone in need is receiving the adequate care and adequate support needed.
Thank you, doctor. Thank you for joining us today for our first episode, First Responders in Lebanon. It was great talking to you. Thank you.
You're welcome. It was a pleasure. Thank you.
This is Leslie.
And this is Diane. And you listen to First Responders in Lebanon on Rabiosa Medina Radio. Tune in every Monday to hear the latest news on politics, immigration, and girl talk from two Chicago Rabiosas. To learn more about the Lebanese Red Cross, you can check out their Instagram at Lebanese Red Cross and their Twitter at Red Cross Lebanon.
On episode 2, we will speak on the hardships that sex workers are facing during COVID-19. Music was produced by 20 Elbridge and cover art by Arte Triste. Thank you for listening. See you soon. Besos.